Welcome to HESI Test Prep 2025. The HESI exam is an entrance exam required for many nursing programs. It's a predictor of nursing student success, and many schools use the exam as a part of the admissions criteria for acceptance. Not all colleges and universities use HESI. The HESI Test Prep app helps you to collect resources for exam prep. Just open up the Google Play Store and install the app. In today's lesson, we will discuss some important questions about nursing procedure. Question 1. What is the primary purpose of the nurse performing a sterile technique during a procedure? Option A. To reduce patient discomfort. Option B. To prevent infection. Option C. To ensure proper medication administration. Option D. To expedite the procedure. Answer is B. To prevent infection. Question 2. Which of the following is the most important step when preparing for a surgical aseptic procedure? Option A. Verifying the patient's identity. Option B. Hand hygiene. Option C. Providing preoperative medication. Option D. Checking the surgical instruments. Answer is B. Hand hygiene. Question 3. What is the primary function of a nasogastric tube, NGT? Option A. To administer nutrition. Option B. To relieve gastric distension. Option C. To aid in swallowing. Option D. To monitor gastrointestinal activity. Answer is B. To relieve gastric distension. Question 4. When performing an injection, what angle is typically used for intramuscular IM injections? Option A. 15 degrees. Option B. 30 degrees. Option C. 45 degrees. Option D. 90 degrees. Answer is D. 90 degrees. Question 5. Which of the following is the most appropriate intervention for a patient with a clogged catheter? Option A. Irrigate with normal saline. Option B. Remove and replace the catheter. Option C. Increase fluid intake. Option D. Administer a diuretic. Answer is A. Irrigate with normal saline. Question 6. Which of the following actions is required to properly dispose of a needle after an injection? Option A. Place it in a trash can. Option B. Place it in a sharps container immediately. Option C. Soak it in disinfectant for 5 minutes. Option D. Leave it on the bedside table until the end of the shift. Answer is B. Place it in a sharps container immediately. Question 7. What is the purpose of using a pulse oximeter during patient assessment? Option A. To measure blood pressure. Option B. To monitor oxygen saturation levels. Option C. To assess cardiac rhythm. Option D. To measure temperature. Answer is B. To monitor oxygen saturation levels. Question 8. Which of the following actions is appropriate when performing a blood pressure measurement? Option A. Inflate the cuff until the patient complains of discomfort. Option B. Position the cuff 2 to 3 inches above the elbow. Option C. Record the first sound as the diastolic pressure. Option D. Use the left arm only for all patients. Answer is B. Position the cuff 2 to 3 inches above the elbow. Question 9. What is the most common complication of an intravenous IV line? Option A. Phlebitis. Option B. Hemorrhage. Option C. Pneumothorax. Option D. Hypothermia. Answer is A. Phlebitis. Question 10. Which of the following actions should a nurse take when administering oxygen to a patient with COPD? Option A. Administer oxygen at high flow rates. Option B. Monitor the oxygen saturation carefully. Option C. Keep oxygen at the highest concentration possible. Option D. Use a non-rebreather mask at all times. Answer is B. Monitor the oxygen saturation carefully. Feel free to join us at HESI Test Prep private study group or follow us on HESI and T's study group.